Okay, so today we're going to be talking about BANKART lesions. We're going to talk specifically about what a BANKART lesion is, what's the anatomy and physiology of the labrum, particularly in the shoulder, how this injury affects our dynamic stability and just our day-to-day activities when we're reaching overhead or moving our arm out, and then the different treatment options if this is something that's happened. Get ready, this is Educated Fitness. Alright, so today we're talking about, like I said, BANKART lesions. And why are we talking about BANKART lesions? Well, because I was so lucky to have this happen to me. So I'm going to show you a little video here. We're going to analyze what happened when I went through this. So you'll notice in this video, what I'm doing here is I'm going for the old Rayleigh. What that is, that's the Superman on the wakeboard. And so what's happening here is you watch me go, I kind of get twisted, and you can see this here. As I get twisted, the tension from the line in the boat starts to get a little intense, and as you notice, my right arm gets extended out here in front of me to the side, and this is important because this is what happens when most people dislocate their shoulder, is they land with their arm outstretched and in front of them. Now I'm not landing, this is happening in the air, this isn't the ground, but the rope and the tension of the line is actually acting the same as if I'm landing on the ground. And so right here you can see in the air, my arm is outstretched, it's in front of me, it's too far, and my shoulder dislocates. And it dislocates anteriorly and inferiorly, which causes a BANKART lesion most all of the time, and we'll talk about that a little bit here. But yeah, so there's that, and then here's a video of me actually landing a Rayleigh, so you know that I can actually do it. A BANKART lesion is actually very, very common with shoulder injuries, especially with anterior dislocations. I was looking at several studies, and they actually showed, they did a sample size. There's about 96 people in one study, I think 80 in the other, and they were people that had either traumatic dislocation or recurrent dislocations. And of their participants, every single one of them, 100% of them, had a BANKART lesion with their dislocation. That's not the case, obviously, with everything. There are exceptions where this doesn't happen. But a general rule is 80 to 90% of the time, a BANKART lesion will occur with an anterior dislocation. And an anterior dislocation happens 95 to 97% of the time that your shoulder is dislocated. So it's a very common dislocation, and it's a very common injury that happens with the dislocation. In an anterior dislocation, what happens is the head of the humerus goes forward. So when you're landing like this, your arm gets pushed that way, your humerus comes this way. Why a BANKART lesion is so common with that? Because a BANKART lesion is the tearing of the anterior part of your labrum. So that tears as that goes out, and all of a sudden you've got a labrum that's not attached any longer. The reason these anterior dislocations are so common is because they happen when we fall like this. And how often does that happen in sports? All the time. You fall, you stretch your arm out, and then boom, your shoulder pops out of place. So very common injury, very common method of injury. It's happening all the time. And so let's talk a little bit about what the labrum actually is. As I'm saying, you know, BANKART lesion is a tear of the labrum. What is the labrum? So in your arm, you've got your humerus, and then you've got your scapula. So your humerus is the long bone here. Your scapula is the little socket that it sits and it fits in. So this is pretty good. We've got that ball and socket to try to keep it in place when we move our arm all different directions. That's supposed to stay. But the bone of your scapula is actually only covers about a third of the humerus. So it's not very deep. So you can imagine if it's not surrounding the bone very well, when you're reaching overhead, when you're reaching out to the side, that arm would just pop out of place all the time. Without a labrum, I don't know if overhead activity or sports throwing would even be possible, because I think our arm would just dislocate all the time when we do those kind of things. But thankfully, the labrum is a rim of fibrocartilage that you've got the socket. It adds about another 2 to 4 inches all around, making it deeper, making it able to fully connect with the humerus. Not only does it add just like a little deeper socket, but there's actually something called the viscoelastic piston effect. I know it's kind of like big words, but what's going on in just simple terms is it creates a negative pressure that basically acts like a suction cup. So when you're moving, it's actually kind of suctioning the humerus in, so that when you're throwing, when you're moving your arm, it has that extra protection. And then one last thing that the labrum does, it actually serves as an attachment site for several of your rotator cuff muscles and ligaments all up in your arm. So you can imagine not having this or having it detached. You lose the viscoelastic effect, you lose the attachments of the other stabilizers, and you lose in some areas where it's torn, you lose the depth of stability, that circle that's surrounding the joint. So very important structure of the labrum. And if it is detached, it does not reattach by itself. It doesn't have the ability to do that. It's got to be surgically reattached. So you can imagine then if the labrum is detached, you're probably going to need surgery to get it back. And that was kind of the big bummer news for me, is that I was going to need surgery. I was hoping to just be able to rehab it on my own. But studies show, and I did a lot of research, the doctor told me this, but then I looked up everything on my own too. If you are under the age of 30, and if you participate in high levels of sport or activity, especially involving the arm, your chances of dislocating it again are 70 to 90%. Very high likelihood that it's going to pop out of place again if you don't have surgery. You can try and rehab it yourself. You can try and strengthen the muscles in the rotator cuff to support it. But like I was saying, the labrum does more than just offer that, what a muscle can do for support. It has that suction cup effect. It's also an attachment for other muscles. So there's only so much you can do without surgery. If you do get surgery, your chances of dislocating it are less than 5%. So you kind of weigh those scales, 90% chance that I'm going to dislocate it again versus 5% chance I'm going to dislocate it again. Kind of makes surgery a no-brainer if you're young, if you're active. If you're older than 40, and if you are not super active, you can maybe get away with it because you might not be putting your arm at as much risk and it might not dislocate and you could be okay. And that's obviously something to consult between you and your doctor if this is something you're experiencing. And then just a little bit of personal experience, not from me, but from a couple friends. I've had friends who, as soon as this happened, one of them texted and said, you need to just get the surgery right away. One of them, he's a physical therapist, and he thought, oh, I can just rehab it myself. I can just get all the rotator cuff muscles nice and strong, and everything will be fine. And so he did. He went about 6 months, and I think he was playing basketball when he dislocated it again the second time. And then he said he started dislocating it every couple months. Then it started happening like every month. Then it started happening every week. Then it got to the point that he would just be leaning up against a wall and it would pop out of place, or even sneezing would cause it to pop out of place. So finally he gave in, got the surgery, and says now it feels a lot better. And my other friend was a very similar experience. If you're young, if you're active, the odds are in your favor to just go ahead and get the surgery, get it done. It's a long rehab process. It takes about 6 months before you're back to being able to have full use of your arm, but it's that versus years of dislocating it more and more and more, because the more you dislocate it, the easier it's going to get to dislocate, and it's just going to continue on that cycle of dislocating easier and easier and easier to the point that it really affects your quality of life and your ability to do things. And so whatever you decide to do, surgery, rehabbing it on your own, this isn't an immediate emergency condition. You can put it off, you can think about it, you can take some time to see how you feel and how the shoulder's doing on its own. If you want to, play the odds, maybe you're one of the lucky 10% that it doesn't dislocate again. Maybe you've got that good genes. Maybe it's not as bad of a tear as other people's. So you can play those odds. You can try and rehab it on your own and see how it goes for a little while. Like I say, it's not an immediate need, but again, consult your doctor, consult those professionals around you if this is something that's happened to you and you're trying to weigh out whether you should get surgery or not. I would recommend, if you are younger than 30 and if you want to participate in sports again, to just get it done. Pick a time that works and go forth, and just, it's no fun to be a patient, but we've all probably been there at some point. You'll come out better in the end if you're going to be participating in sports and activities. BANKART lesion, it's a tear to the anterior labrum. It happens with a dislocation, usually an anterior dislocation, which happens when you fall on an outstretched arm. Force comes, shoulder goes that way. Labrum tears from the bone, humerus comes out. Got to be reattached with surgery if you want to fix it. You can leave it alone if you want, but likely that your shoulder is going to remain unstable. So again, I hope that this was helpful. If this is something you're going through, I hope it was beneficial. I hope you can learn a little bit more about what your options are, what your prognosis is. Your prognosis is great if you're an athlete and you get the surgery. Like I say, less than 5% chance that it's going to happen again. Good outcomes if you do that and you do the therapy. Put in the work, get it done, and things can turn out well. If there's anything that you would like me to talk about further, any questions you had specifically, leave them in the comments. I'll answer those and hopefully put some future videos out based on what you guys are interested in. If you know anyone who could benefit from this video, share it with them. Please like and subscribe. And thank you all. Good luck with the rehab. I really appreciate it.